How realistic were the medical procedures shown on Have you ever wondered how realistic the medical procedures were on the iconic television series As we reminisce about the early 2000s, this show brought emergency medicine into our living rooms like never before. While was known for its gripping drama, the accuracy of its medical content is a fascinating topic to explore. The medical procedures shown on were moderately realistic, but they did have some inaccuracies, especially when compared to real emergency medicine practices of the early 2000s. The series benefited from input from actual doctors who helped shape its storylines, but it often dramatized or simplified medical procedures for entertainment purposes. For instance, cardiopulmonary resuscitation was frequently depicted, but often in a way that made it seem more successful than it typically is in real life. In actual emergency rooms, CPR is not always effective, and defibrillation is used only when necessary, not as routinely as shown on the show. Additionally, the use of paddles for defibrillation was outdated by the 2000s, as adhesive pads had become the standard in real medical practice. The series did a great job of capturing the fast-paced, high-pressure environment of a busy emergency room. However, it simplified the multitasking and workflow that medical professionals experience. Often, fewer team members were shown than would realistically be present during critical procedures. When it came to patient demographics, tended to focus on dramatic and severe cases, which are not always representative of the typical cases seen in real emergency departments. The show also had a less diverse patient population, with fewer women and minority patients than you would find in actual emergency rooms. Some medical equipment and techniques were portrayed accurately, but others were outdated or oversimplified. For example, intravenous insertion and intubation were often dramatized, making them appear easier than they are in real life. To keep viewers engaged, sometimes exaggerated medical scenarios or compressed timelines. Procedures were shown happening at a much faster pace than they would in reality, often combining multiple interventions in a short period. From a 2000s nostalgia perspective, was influential in bringing emergency medicine into mainstream culture. It set a standard for medical dramas by blending medical facts with compelling character-driven stories. While it was not perfect, the show's portrayal of medical procedures was more realistic than many other dramas of its time, contributing to its lasting appeal and influence on the genre. In summary, Wyler's medical procedures were fairly realistic for early 2000s television. They included simplifications and inaccuracies typical of dramatized medical shows. Its mix of realism and drama helped define the nostalgia surrounding 2000s medical television, making it a memorable portrayal of emergency medicine despite its flaws.